Now, instead of jumping ahead and filling out the forms and checking off a few boxes, a much better place to start is by reflecting on what's most important to you, your goals, your values, and your wishes, so you can live a long and meaningful life according to your own terms. A great place to start is by thinking about your current overall health. You may be generally in great health, like that 18-year-old getting ready to leave for college, or you may be a 98-year-old with a serious advanced illness, like metastatic cancer or end-stage heart failure, or frankly, like most of us, where we're somewhere in between. Understanding your overall health status allows you to think more clearly about your future goals of care. If you're not sure about your current overall health, ask your primary care doctor to go over it with you. If you don't have a primary care doctor, I absolutely encourage you to get one. Now, let's focus on your individual goals of care. To me, this is the single most important step of this entire process. Why would I say that? Because we all have goals for our own health care, whether or not we think or speak about them. I suggest you start by thinking about three major life goals which we all share. Number one, how it is that you go on prolonging your life. Number two, your ability to live independently and maintain independently your own daily functions. And number three, your overall comfort, such as maintaining adequate pain relief and treating unpleasant symptoms. Now, if you are young and healthy, it may be very possible to meet all three of these goals, even if you experience an acute and serious illness. However, for others, that may not be possible to obtain all three goals. So what do? You think about which of those goals are the most important to you. Let's consider some common points of view. Many patients say, if I have an illness which I'll never recover from, or have the ability to live an independent life without being hooked to machines, then I don't want to receive or continue to receive life-sustaining procedures. Alternatively, some patients believe as long as I can open my eyes and recognize my family, or frankly, even if I can't open my eyes and I can't recognize my family, then I don't care if I have to be artificially fed or rely on others or have someone else even wipe my bottom. Neither of these choices are wrong. Your quality of life goals are very important and they are very personal for you. And they should fundamentally reflect your own values and your own goals for your healthcare needs. However, the goals you decide on today may in fact change as you get older. They probably will. That's why many experts advise us to revisit our values and to revisit our goals over time. Some even suggest that we rethink these life choices as we experience any major kind of illness, or at least every 10 years, like at the age of 30, or 40, or 50, or 60, or so on. So let's recap where we're at now. When starting to think about your future healthcare decisions, it's often best to know your current health status, and then think about what's most important to you. To help you get started, here are a few more questions which I think you ought to consider. Number one, what do you value most about your life? Do you prioritize being very active? Do you prioritize relying on care from others? Do you really want to focus on living the longest life possible? Number two, do you believe that life should always be maintained even if there is no chance of recovery? Number three, when would you not value life-sustaining treatments? For instance, if you would never regain consciousness nor be aware of your surroundings or of other people, or if you could not take care of your daily needs or be able to make everyday decisions for yourself, or if you were in severe pain and even suffering terribly? Number 4, do you hold any religious or other personal views which may influence accepting or rejecting any medical treatments? And finally, number 5, have you heard about difficult situations affecting other family members, friends, or even other people you've seen in the news? What would be your reaction if you were in a similar situation, much like the case of Nancy Cruzan? What decision would you make, and would you expect to be kept if you were in such a situation? These kinds of questions will help you think about how you'd like to live your life, and they can be useful when starting a conversation, which is the most important part, with yourself, your family, and your doctor. And remember, it's most important for you to decide all of these questions for yourself. What's most important to you and why it's most important to you.